Welcome back to Vet Med Corner. I'm Dr. M. Nice to see you, whether you're joining us after watching a different video or whether you're new here. Today we are going to talk about some common presentations of various symptoms that are emergencies. So join me and hopefully you'll learn something. A very common thing that we will get questions about is whether a pet who is vomiting or having diarrhea is an emergency. So here are some things to consider. One, has the vomiting and or diarrhea been going on for any significant period of time? Like, there's a difference between a pet who has vomited once or who has one diarrhea bowel movement and then is otherwise eating completely normally, acting normally, playing normally, drinking normally, there was no blood in the vomit or the stool. You know, that type of pet who's had one incident, you could likely monitor for a little bit. This is in stark contrast to the pet who has blood in their vomit or in their stool, or a pet who has lost their appetite, a pet who is acting tired, a pet who continues to vomit or have diarrhea, who doesn't want to eat. That sort of a pet needs some intervention. Your veterinarian will need to do an exam to try to rule out some of the causes of vomiting or diarrhea. They may recommend some imaging, like an x-ray or an ultrasound, to look for foreign bodies, to look for inflammation through the GI tract. They may test for parvo, they may test for different intestinal parasites. It will all depend on what's exactly going on with your pet on that physical exam. And then your veterinarian will be able to implement some treatment depending on what all is found. Let me try get some video of my cat. The next situation, I'm going to talk about times when pets are having difficulty with breathing. So you could notice that your dog is panting more than normal or panting constantly even though they shouldn't be hot, being unable to settle down to sleep. Certainly if a cat ever starts panting, that is a problem. They should not pant. Or you might notice that their breathing rate has become really fast, so their chest is heaving back and forth a lot faster than it normally does. Or you could even notice that they're having to use their abdomen when they breathe, like their whole body is being used in the effort of breathing, including the abdomen, all the stomach area. All of these issues are things that need to be checked out right away. They could be heart related, they could be lung related, they could be something else going on. Even severe pain can cause quick breathing like this, but any of these situations are ones where you need to see an emergency clinic, or if your regular veterinarian has an appointment time available, you need to be seen right away. Potential emergency number 3. If there has been a toxin ingestion. Common toxin ingestions are things like xylitol, human medications, the active ingredient in marijuana is THC, and that is toxic for our pets as well. There are a number of home remedies that you can find listed online, but those tend to be dangerous and not work very well. The best thing that you can do is contact the TOXIN hotline. They can help you to assess the risks associated with the amount that your pet has ingested, but you should also likely head to your vet clinic right away, because this is time sensitive. The longer the toxin is in the body, the more will be ingested and the more side effects and issues that you can see. Your veterinarian will have drugs that can be used to induce vomiting, that are the safest and most reliable in doing so, and then they can also start other treatments depending on what type of toxin has been ingested. There are also a number of toxins that should not be vomited back up, as they can cause more damage to the esophagus or cause aspiration concerns, which can lead to a whole host of other issues. So vomiting is not always the right answer, which is another very important thing to remember, and why you should seek veterinary advice if you know your pet has eaten something that could be bad for them. All right, issue number 4 that we're going to talk about. This is anything to do with your pet's eyes. Eyes can be quite fragile, and issues with them can get very serious very quickly. It's because of this that any eye issues are considered emergencies until proven otherwise. Also, eye issues tend to be quite painful, and so your pet needs to see a veterinarian if something happens to their eyes. Symptoms you might notice at home include squinting. That means that your pet is in a lot of pain if they're holding one eye a little bit shut. You could also see redness to the eye. You could see a lot of tearing from the eye. If there's trauma surrounding the eye, you could see bleeding from the eye. You could see cloudiness, any change that you note with the eye. Really, it needs to be checked out right away. All right, let's move on to topic number 5. For this, I'm going to include bite wounds and other trauma. The reason that these need emergency attention the vast majority of the time is because they need to be properly cleaned out, and because they're painful, this is quite hard to do with our pets. It's not fair to them and will really scare them and hurt them to try to do it without having pain management and even sometimes some level of sedation or anesthesia, depending on the severity of the wound on board. And so you need to see your veterinarian promptly because waiting will increase risks of infection in the wound. And also, the older a wound is, the more limited we are with the ways that we can attempt to treat it. A fresh wound gives your veterinarian the most options for treating it, and it also gives your pet the best chance to heal with as few complications as possible. All right, so I recorded everything for this top 10 list and then realized that the video was becoming quite long when I started editing it. As a result, I've decided to split it into 2 different parts, and so you've just watched, of course, the first half, and we will see you soon for numbers 6 through 10 on this list. Take care.